Okay, we have a 10-month-old boy who's referred to the hospital because of suspected severe pneumonia. During the first few months of his life, he developed upper airway infections, bronchitis, and diarrhea. His immunizations are up to date. He has failure to thrive. Upon admission to his local hospital, the boy has mild respiratory distress, crackles, and auscultation. His temperature is 103.1. O2 saturation is 95% in room air. The quantitative immunoglobulin tests show increased IgG, IgM, and A. Now, the peripheral blood smear shows leukocytosis and normochromic normocytic pneumonia. A chloride sweat test and tuberculin test both are negative. Chest X-ray reveals bilateral pneumonia. BAL is done, and microtests show gram-neck bacteria with growth of Burkholderia capacia on culture. Lab results are as follows. We have leukocytes 36,000 and lymphocytes are 16%. Eosinophil 1, mono 2, HB 7.6, creat is 0.8, and BUN is 15. So this is a pretty rare disease, which is good news. So it's an X-linked recessive. We just learned we have NADPH oxidase gone. This is the key enzyme. I'll just read the highlights so that we don't repeat it again, and I hope you guys don't get bored. Now, we just learned about CGD, right? I think it's pretty much the same. All right. Okay. There's an oxidative burst in neutrophils. We have NADPH moving on to HOCl. The deficiency of MPO, we just read it. I don't think this is required. Okay, from here, the nitro blue tetrazolium test detects your oxygen burst, but in CGD, the respiratory burst is absent, so your NBT will be abnormal. In contrast, the respiratory burst is intact in MPO deficiency, because MPO is not about that. So that's how you differentiate MPO and your NBT. Keep this in mind, because NBMEs will ask you such a question. I'll screw you around. That's it. Right, so just keep it in mind, CGD and MPO deficiency. 128 is micro. Acha. Okay, Yash, thank you. So I think they're just mentioned in one line, maybe in those sections. That's why.
Thanks for watching. Please give a thumbs up and subscribe for more.